Hello everyone, and good evening all. Let's start our today's role play session. We are going to discuss today random cases. So, who wants to perform role play with me? You can write your name on the chat box and we can start.
Sorry, guys. I'm just stopping a little bit, just stopping by to start the session today. So I can see a lot of you are here and many of you wants to do the role play as well. So this is our free 2 week sessions. And as you can already understand, we had our class yesterday as well. So thanks for joining the sessions back to back. So tonight is mainly about the clinical session, which is based on random role play. Random role play sessions are taken by some of our other doctors as well. And today is Dr. Cynthia, who is going to take your session. So she has been with us since we started the course, and she is also working in Australia currently. Very well-known mentor for First Aid AMC Clinical, and I'm sure that you will also enjoy the session today. So if there is any queries, you can definitely ask to Dr. Cynthia, but any course questions, any admission related questions, keep it for me. I will answer that during our other sessions. Okay. So good luck, everyone. Thank you, Dr. Cynthia.
Thanks, Dr. Arshan. Then let's start our session. Dr. Karthina, are you there?
Hi, yes.
Hello, just give me a sec. I'll share my screen first. This is your case and your 2 minute starts now. You can start, doctor.
Okay. Hi, Kylie. My name is Kirtana, one of the doctors in the neonatal ward today. I understand baby Emily has presented with vomiting difficulties. Before I ask you some questions, I'm just going to chat with my examiner to make sure that baby Emily is doing okay. Is that all right?
Sure, doctor.
Dear examiner, is Emily hemodynamically stable for me to proceed with questions?
You can proceed.
Thank you. So Kylie, I understand Emily is 18 days old and she's been having vomiting and feeding difficulties. Could you tell me a little bit more about this, please?
Yes, doctor, as you know, she's just 18 days old, but since she born, I noticed like she's vomiting multiple time, and she looks very hungry, but she's unable to suck on the breast. And we tried everything, doctor, and my other family member, they have also tried feeding with her like cow's milk as well. So I don't know, doctor, what's wrong with her, but we are here. We want to know what's going on.
Sure, that sounds quite distressing. I'm so sorry you had to undergo this. Can I know more about this vomiting? So it started from the day of her birth, or it's just something that started a few days ago?
Pretty much the day she born.
Sure. And is this vomiting projectile? Like, do you feel like it's going on distance and just pulsating and drooping near her mouth?
Both, doctor. If she's like having some milk, then it would be bit forceful, and other time it could be like sips of cloth. Um,
Sure. And what color is the vomit? Is it just milk or is it green color?
Cream color, like curdled milk.
Cardamom color, sure. And is it large volumes or just small volumes?
Um, yeah, mixed, doctor.
Mixed, oh, sure. And is baby having any fever?
No,
Any abdominal distension?
no.
And how is the bladder? Is she avoiding you passing urine okay? Any difficulty or small amounts in comparison to the beginning? How many wet nappies are you changing?
Um, Maybe two or three, and she's my firstborn, doctor. So
Good. No,
so I'm not sure like what should be the normal.
sure, that's understandable. And has she opened her bowels after birth? Like, is she been pooing okay?
Yeah, that is greenish color initially.
Initially green, but now it's just soft brown.
Yes, doctor.
And there's no blood or any red currant jelly stool or anything like that.
No blood.
No. And I'm sorry, did she have fever?
No.
No. And any, do you feel like she's crying excessively when she's weeing and the urine's red color?
No.
No. And how has her weight been like after she's born today? Like if you had checked it, is she like losing weight?
Her birthday weight was 3.5 kilo, and after that, now maybe 4.
Kilos. Okay, so she's
Yeah.
gaining weight. That's a good sign. Also, I want to know that you mentioned that you tried cow's milk on the baby. So did the vomiting start after you started the cow's milk, or it's been ongoing before that?
Um, that was before, like vomiting was before cow's milk introduced, but after that, like we noticed like no improvement.
Right. You just trialed it to make sure if that
Yeah.
would affect the baby. Sure. And definitely no diarrhea. Baby's not passing any excessive diarrhea.
Yes.
And can I know a little bit about her birth history? Was Emily a normal delivery baby or cesarean baby?
Normal birth.
And any complications during birth? Any NICU admissions?
No.
And baby was immunized up to date.
Yes, doctor.
And development-wise, you're not concerned. She's age appropriately smiling.
Um, I think so, doctor.
That's good. And any contact history, like are you the only carer for the baby? Does she go to any daycare or anyone else taking care of the baby?
Me and my partner.
Sure. And you guys are not symptomatic at all? No loose stools, no diarrhea or vomiting in any one of you?
No,
No. And after giving the baby cow's milk, did you notice any rash in her body or any itchiness, anything like that?
no, doctor.
No, sure. Thank you so much, Kylie. I'm just going to so get from the history and examination. What I think is due to this excessive vomiting, Emily is a little dehydrated. So the first step of management would be to give her some fluids. Since she's finding it difficult to suck on the breast, we need to make sure that she's adequately hydrated. In babies this small, I would first suggest we put in an NG tube and get some fluids. You need to stop breastfeeding during this time. We can try a lactation nurse to kind of express your breast milk, and we can trial that as well. But for the time being, what I need to know is she needs to be put on an NG tube. The other thing I'm worried about with Emily is you did mention she had projectile vomiting. This is a concern for me, usually within this age group, when the baby is having projectile vomiting and quite dehydrated and lethargic like Emily, we are very suspicious of a condition called pyloric stenosis. So this condition is commonly seen in babies between 2 to 6 weeks old. What happens is in this condition, if I draw a picture to you, I would tentatively draw a stomach, a large bag, and then there's a pylorus. This is a portion which connects the stomach to the intestine or the small gut. So sometimes in babies, this can be enlarged. This is called hypertrophy. The muscles can be thickened. This prevents the milk from going into your gut and instead accumulate in your tummy. So what happens is the baby kind of brings it out from the mouth. So in Emily's case, I think that's what's happening. This is preventing her from sucking onto the milk. She's vomiting, and this has caused moderate to severe dehydration in her. I understand we've got a slightly distended abdomen, but I need to clarify this by doing a physical examination. So the next step would be, unfortunately, I have to tell this to you, this is a surgical case. This is considered an emergency. We will need to keep the baby nearby mouth for the time being. And like I said, the NG tube will help bring out everything in the tummy out. In a normal case, we would give the baby food or fluids to kind of hydrate her first. But in Emily's case, we're going to put in a little line, IV line, get some basic bloods, start her on IV fluids to kind of get her rehydrated. In the meantime, I will let my senior know, and we'll get you a surgical opinion from the pediatric surgeon. They might, it's usually.
Doctor.
Yeah.
Very nice performance, Dr. Karthina. Most of the question in history, I noticed you asked me. Just say one question I want to clarify with you. Otherwise, like how you explain your diagnosis, explain to the mom, that was really nice. And the missing part was investigation. Okay. So what my suggestion would be, because I noticed you explained details about the management plan. Management plan not in your task. Your task is investigation first. So my advice would be just finish your task first. Then if you have time left, explain management. You get my point?
Yeah.
So here, finish your task and then explain management if you got time, okay? Coming to the history, so what I noticed, like you asked very good history, like bowel habit details, diet habit, and also any infection related question. That was really nice. Just a question asked about like either vomiting each time happen after feeding, or vomiting can happen anytime. Okay, so just to confirm, either that is related with that pyloric stenosis or any other causes or not. Otherwise, like most of the things I noticed that was asked. Yeah, and yes, I noticed you asked me as a mom, like you asked me, have you noticed any abdominal distension? Just you can ask like, have you noticed any lumps on the like tummy or like,
Yeah.
yes, otherwise, very nice performance, but because of the time and you didn't finish mentioning about the investigation. Okay.
Yeah.
So let's discuss the case. Before explaining how to perform this case, just would like to let you know, guys. So this is a random role play session. I'm going to discuss like all the random cases. It would be like PIDS case or ONG or any medicine surgery, any cases, okay? But in your theory class, you will get like cluster-wise approach that will come with like medicine cluster-wise, surgical cases cluster-wise, or like ONG, PIDS, psychiatric case, all the cluster-wise approach, okay? So that would be coming with that theory course, and that would be like giving you people who are like very just who freshly passed their MCQ and started their MC clinical journey. Definitely that gonna help them to understand like how to start your preparation. And that role play session, I would also encourage for the beginner as well, so that like you can understand what exactly the real scenario would be in your exam. Because in your exam, you will get that random cases, okay? It's not like that 4 medicine, then finish, then 4 surgical case coming. It's not like that. It would be like random with physical examination as well, okay? So just to refresh all of you, so for you will get 10 minutes time, so 2 minutes reading and 8 minutes performance. But in this year, it would be like mostly face-to-face exam. So 2 minutes that reading time would be outside. And that 2 minutes time, unfortunately, you are not allowed to write anything. So my suggestion would be read your case very carefully and think about that differential within that 2 minutes time and try to think about key point of this case, okay? And then 8 minutes your performance time. Within this 8 minutes time, you have pen and paper so that you can write whatever you want. But my suggestion would be, when I was in your position, because I always put emphasis on differential and key point. So when my 8 minutes started, like when I started my performance, so I quickly jotted down my all the differential on the paper and also like key point, so that like when it's time for wrapping up, so I'm just, you know, quickly eyeball on my paper and I just noticed, did I miss anything? Okay. So that would be your 8 minutes. And when 8 minutes finish, then you need to leave the room, or because previously it was online, so like you will take to the other rooms. So that's just a structure for this exam. So let's discuss this case. But if you have guys any question regarding any how that clinical exam happened, like you can write down in the chat box and we can discuss, okay? So this is the case. An 18 days old baby girl, Emily, is admitted to the neonatal ward with a complaint of vomiting and feeding difficulties. So her mother, Kylie, reports that the baby is vomiting curdled milk after feeding, and despite appearing hungry, she is unable to suck on the breast effectively, and the family has tried feeding the baby cow's milk. On examination, the baby appears hungry with dry mucous membrane and a slightly distended abdomen. There are no other significant findings. So your task is take a history, give diagnosis, and explain to the mom until investigation you would advise. So for the pediatrics case, our structure should be like history structure. If you notice this is the acute case, make sure you are asking, hemodynamic stability at the beginning. Okay, so ask your examiner, I would like to know vital sign of my patient. How about the dehydration sign? And also you can ask about quickly temperature, pulse rate, blood pressure, respiratory rate, saturation. Okay. Now coming to the history. So here you need to ask about all vomiting related questions. So history of presenting complaint. So if coming with vomiting or any bodily fluid, you should ask about CCVO. Okay, so that is the mnemonic you need to follow. So all that structure-wise approach you will learn from theory course. Okay. So vomiting, you should ask about when did the vomit start? Is it after every feed? How soon after feeding does the vomiting occur? Is it immediate or delayed? Okay, and what is the nature of the vomit? So you should ask about like milk curd, any blood in it or any greenish color in it. And very important, that is the key point in this case, you should ask about either the vomiting is projectile or just sips over the cloth. Okay. And ask details about feeding questions. So how often are you feeding the baby? Is the baby latching properly? And have you noticed any difficulties during breastfeeding? And you told me that you have also introduced that cow milk. So have you noticed that vomiting started after the cow milk or vomiting already started prior to cow milk introduced? Okay. And has the vomiting worsened after that? So another key question you should ask details about is stool and urine question. So how many wet nappies per day and any reduced number of the wet nappies to know about dehydration sign. Okay. How's about a baby's bowel movement? Frequency, color, consistency you should ask. And also you have to ask about the color of the stool, either it's a pale or whitish color or like greenish color or any blood, any diarrhea, any mucus, you should ask very specifically. Okay. Coming to the binds and well baby questions. So birth history, immunization, nutrition, development, social history. So ask about what about the birth history? How Dr. Karthina asked me, was it a term pregnancy, preterm? Was there any cesarean section or normal vaginal delivery? You should ask. Immunization up to date or not? How about nutrition development? You can ask about birth weight and what about the current weight now, so that you can compare either babies gaining or like, body weight reducing. Social history also important. Just ask about like how you are coping with, do you have enough support? Well baby question, always for the peers case, you have to ask about well baby question. So well baby question comes with sleep, pee and poo, eating, drinking, like those questions. Okay. And as I mentioned, important question is like, did the baby pass meconium within 24 hours apart? Okay. Physical examination, not your task, but I put the slide just so that you can get an idea. Okay. So we have already done vital sign. Just ask about general appearance, either baby is hungry looking or not, alert, any sign of lethargy or not. Then ask details about sign of dehydration. For face-to-face exam, examiner might ask you like what you are looking for, like sign of dehydration. Like you are going to check like skin, like poor skin turgor or not, like then shrunken fortnightly, capillary refill time, and also like vitals also important. Then ask about abdominal examination. So details like inspection, palpation, percussion, and auscultation. So for the time purpose, because it's not a physical examination, you are just asking the finding from examiner. So my suggestion would be try to be very quick, okay? And please ask 2 questions at a time, not more than that. Just ask examiner, I would like to know about the inspection of abdominal examination. Is there there any obvious distension, any obvious mass, any scar mark, any redness have I noticed or not? And then ask about like palpation. So superficial deep palpation, ask about it, any palpable mass or tenderness, any distension, and then ask about bowel sound present or not. Other system examination, like quickly you can go through. And definitely you should check a hernial orifice as well, okay? And genitalia. And other system, as I mentioned, quickly you can ask about respiratory, cardiovascular. And then for peds, please make sure you are asking about office test, urine dipstick and blood sugar level. Any patient, like like kids coming to the emergency department, we like most of the time we are doing like urine dipstick and blood sugar level check, okay? So just make sure you are asking that question. Based on the baby's symptoms, vomiting after feeding, dry mucus, and slightly abdominal distension. So the most likely diagnosis could be pyloric stenosis. And this condition occurs when the muscle between the stomach and the small intestine thicken and gets get narrowed down, and preventing food from moving from the stomach into the intestine, okay? And the baby may vomit after feeding, and he or she may appear hungry and have sign of dehydration, which all fits together the clinical presentation here. And I'm really concerned about the pyloric stenosis. As I mentioned, management, not your task. So please focus on finishing your task first, okay? Just explain that the condition of pyloric stenosis. So for the clinical exam and face-to-face one, as I mentioned, you will get paper and pen. So try to draw a picture. You can draw a stomach, pyloric part, and you can say that pyloric stenosis, this is a condition where the muscle that allows food to pass from the stomach to the intestine that becomes like thickened and making it hard for milk to move through, okay? And that's why your baby is vomiting like curdled milk and it still seems she's hungry. And that's why the vomiting may become very forceful. But don't worry, it's a treatable condition. You should always give like reassurance to the mom, okay? But we'll need to confirm this diagnosis by doing some investigation, okay? And in the meantime, we'll ensure your baby stay hydrated, as the vomiting can lead to dehydration, which I can see in your baby's mouth. She looks dry and she's passing urine enough. Okay, so what investigation for this case? I like to follow structure, to be honest. So each and every case, if investigation coming, my approach would be blood, urine, and imaging. Okay, so blood test, what investigation I'm going to do in this case? All the routine blood like ABC, UEC, and also blood gas, and all the electrolytes as well, as I mentioned, like sodium, potassium, very important. All the electrolytes I'm going to check. And urine, we have already done urine dipstick, and if anything concerning, we can send for urine microscopy culture examination. Blood sugar, we have already done. And imaging wise, the best way to confirm the diagnosis, it would be abdominal ultrasound, okay? And other things you can advise to monitor body weight as well. Management plan, not your task, but if it will come, you can mention about definitely immediate management would be immediate hydration by giving intravenous fluid and to correct the fluid and electrolyte imbalance. And you can mention keep the baby nil by mouth until seen by pediatric surgeon. So you are going to call your registrar, or you are going to call your boss, so they will come and have a look, and they can after having a chat with the surgeon, they might put NGT in NG tube and nutritional support through the IV. And if pyloric stenosis is confirmed, then definitive treatment would be surgical procedure. Okay. So just explain if you have time management. So our main priority should be dehydration correction, electrolyte correction, nutritional support, and call pediatric surgeon. They'll come and have a look, and if the diagnosis confirmed, surgery would be the definitive treatment. Okay. Vomiting was non-bilious vomiting, Dr. T. So for physical examination, because your performance time, it would be 8 minutes. Within that 8 minutes time, you have to take your history, physical examination, and explain diagnosis and management like that. So sometimes you will get prompt timers, sometimes you will not. Okay, so it will only come time management. My suggestion would be practice role play as much as you can. Okay, and put the timer and perform role play with your study partner. Yes, Dr. Saida, for any of the cases, um, for this baby is presenting with vomiting, so you can ask all the history of present and complaint regarding vomiting. Your differential would be any infection related, any vomiting causes. But for this case, like you need to just explain in this way, like most likely my diagnosis, or I am really worried about pyloric stenosis fitting few clinical criteria, and I need to confirm my diagnosis by doing investigation. Okay. Exactly, Dr. Bono. It's a suspected diagnosis, not confirmed. And we cannot diagnose, we cannot confirm any diagnosis by without doing any investigation. Um, so let's move to the next case. Dr. Raihana, are you there? Yes, Dr. Vishnu, it was very hard to check social development. For this 18 days old baby boy, you just ask about how about the birth weight, that it should be enough. But social smile, or because it's the acute settings, and if you're not asking, that should be also okay. And as I mentioned, the most important thing, either baby is gaining weight or not, okay? Hello.
Hello. Hello, can you hear me?
Yes, I can hear you. Doctor, this is your case. So your 2-minute reading time starts good.
Oh, thank you.
You can start, doctor.
All right. Hi, Jane. My name is Raihana. I'll be your doctor for today. It's nice to meet you. Thank you for coming in. How are you feeling?
I'm not feeling great, doctor. I'm really concerned about my body weight and I want to lose some weight, doctor. But I have tried many things and I didn't have much success. So I came to know about some medication that can also help to reduce weight. Can you please prescribe me that medication, doctor? I heard the name of medication Ozempic.
Okay. All right. Is it all right if I can just have a quick chat with you regarding your concerns first, Jane? Would that be okay? And I'll
Okay.
ask you a few questions, and I want you to know that anything we discuss today will be between you and me, and you can be open with me and you can have a chat about me with regarding anything, all right? Why have you been feeling this way? What was the reason for you to feel that your weight has been increased and your
Because of my partner, doctor, like
because
he being constantly like criticized me and like he told me that I'm overweight. I need to lose weight, doctor.
are you feeling the same as well? Do you feel like you're overweight?
I think so.
Okay. And how long have you been feeling this way?
The last couple of months.
Last couple of months. And is there anything else? Is it only the particular weight you're concerned about, or is there any other parts of the body you're also concerned and you feel like you want to change by any chance?
Doctor, I feel like I'm overweight and that's why like my appearance is not good.
Right. Okay. So regarding when you said this feeling a couple of months and you've been trying everything, can I know what you've done? Or have you been exercising excessively? Have you tried to starve yourself and go on like these crash diets? Are you binge vomiting at all?
I tried some exercise, doctor, but I noticed like that was not helping. Um, so can you please give me some medication, doctor?
Sure. Let me just have a little bit more questions for you. So do you know your body mass index?
It was 23.
It was 23. How much do you understand about your BMI being 23? Do you think that's overweight?
I think so.
Right. All right, Jane. So what want to tell you is, other than that, just a quick thing. Do you have any excessive thirst, excessive uh, drinking habits, or any past history of diabetes?
No,
No. And how about any thyroid diseases in the past? And you have any weather preferences or anything of any choice?
no.
Right. And your daily diet, how is it working right now, given that you're trying to lose weight?
Um, I'm working on it, doctor.
You're having your healthy balanced meals?
I tried to take that one.
Sure. Okay. All right, Jane. I'm sorry you're feeling this way, and it's been quite distressful, probably that your partner is being telling you to lose weight as well. Is your partner being supportive with all of this, with his concerns? Is he trying to help you?
Mm, No, doctor. He just criticized me about my weight.
Sure. I'm sorry. I'm so sorry to hear this, Jane, but I want you to understand, given your body mass index being 23, so 23 is actually not overweight. 23 of a BMI is actually ideal body weight and it's considered normal for your age group. So 18 to 23 is actually considered normal body mass index. It's beyond 25 is what we call overweight, and beyond 30 is what we call as obesity. So I don't think medically you are considered and you come under being overweight. So I don't want you to stress on this at this point, given you are actually in a healthy weight. But it's concerning that you're feeling, and this has been making you feel this distress and the strong urge for you to want to lose weight despite you having a really good weight for your age. Are you with me so far?
So you are not going to give me medication?
So I want you to understand you are actually in a healthy weight. So what you would want to do is, I don't think you need to go on any medication to lose weight. Maintaining this weight is actually good. So for that, we can actually adapt for some good lifestyle modifications, get some healthy exercises in, get some have a healthy balanced diet with, and avoid actually snacking too much and binge eating, rather continue a proper balanced diet with some regular exercises, taking alcohol to some a good controlled levels. And I don't think you need to lose weight at this point. Maintaining this weight with adequate exercise and some good lifestyle habits would be adequate, is what I feel for you.
Anything else that I need to know, doctor?
Any other concerns you want me to have a chat about with you?
No.
Sure. If you can, if you're feeling this way, has your mood been really distressed along with all of these as well?
Yes, doctor, I told you I want to lose weight. Hello?
Hello, can you? Hello.
Yeah, can you hear me?
Sorry. Sorry, Jane, can you just want to know how your mood, despite because of these distressful events, mood has been affected, and how's your sleep been as well, your sleep and appetite?
My sleep also being disturbed, doctor, and appetite. Yeah, okay.
And you're feeling like you're losing interest in your daily activities you wanted to do, and you're feeling like you're unable to concentrate,
Yes, doctor.
and you're feeling low, really low energy levels as well.
Yeah.
Right, okay. Because of all of these thoughts and distressing thoughts, love, I'm really sorry. Have you ever felt like life's just not worth living as well?
No, doctor.
Okay, that's good. But my concerns for you are actually that what you need to know is that your weight is actually quite healthy, but given that you've been having this thought of wanting to lose weight, and that is affecting your mood and all of your symptoms as well, are making me concerned that you're having some symptoms of sort of like an adjustment disorder and sort of a little bit of mild depression as well. So what I'm going to suggest is, like I said, to first suggest to do some lifestyle modifications, and also I'm going to refer you
Your
to
time's up.
sorry.
No, that's okay. Very, very nice performance. Yes, like when you notice your patient, yeah, keep asking you few questions, so you need to address. So patient was like, patient wants to lose weight.
I
This
know.
he explained details about BMI was normal. What I noticed, Dr. Rayana, your approach, performance, that was really nice. Few important point you have missed. One important point, patient was asking about Ozempic for weight reduction.
Yes, I
And
wanted to
she
discuss.
was very, very occupied about that one. So did you address that one? Like, did you mention
I did
why?
not mention that's not relevant for her, not needed. Yeah, should have.
Yes. So you
Yes.
have to explain what is the indication for Ozempic and in which case we are using Ozempic and why patient is not suitable candidate for that. Like explain that one. Very good. Like you came later on and asked me about my mood and all the like um
It just threw me off because the patient was like asking about Ozempic and wanting only that. So I was like, oh, should I go to counsel the patient immediately? But then I would not really ask everything I want to know, but she was stressing on that. So I don't know.
yeah.
So
So any this type of case, and when you smells like it could be psychiatric case. So please
yeah,
don't miss to ask about all the psychosocial history. Okay.
sure.
So when you asked me about psychosocial history, patient having some feature of depression, but in
Yeah.
here, like I asked you multiple times, like I want to lose weight, and you explained me about BMI, but still my question is the same. So she's having preoccupied thought, and like that feature suggestive for body dysmorphic disorder.
Yes. Yeah.
Okay. You need to explain about BDD and all the like CBD, because your second task was counsel patient. That means like you need to go in a relevant like diagnosis, and you have to counsel like why you are thinking and why this patient needs CBD. Okay, I'll explain
Sure.
this. Otherwise, like your approach was really good, but important few things you missed, which is Ozempic you didn't mention. And another thing, this is the case of body dysmorphic disorder. Okay.
Sure. Sure. Thank you. Thank you so much.
So Jen, 27 years female, comes to the clinic because her partner has criticized her for being overweight and her BMI was 23. She feels distressed and is asking help to lose weight. And Jen requests like Ozempic for weight reduction after trying to lose weight on her own without any like significant success. So your task is take a history, counsel patient. So here, starting your explanation or starting your history taking, you can ask about presenting complaint. I understand that you are concerned about your weight and have been criticized by your partner. Can you tell me more about your situation? So ask details about weight history. So when did you start feeling concerned about your body weight? Have you always been concerned about your weight or appearance, or that things recently being developed? Okay, and what method have you tried to lose weight? You should ask details like any excessive exercise, any excessive diet, like ask details. Now coming to your like you need to also think about some differential and diagnosis. So body image and perception. So how do you feel about your body appearance? And do you find yourself excessively thinking about your weight or certain parts of your body? And do you like frequently compare your body to others, or like seek reassurance about your appearance or not? Okay, and how does this affect your life? And has it impacted your social life, work, or relationship? That is really key point in this case. Ask about psychosocial impact. So how you are feeling emotionally, how's your mood, sleep, appetite. So psychosocial history, you should ask details. Okay, so how's your sleep, how's your mood, how's your energy, concentration? Do you think life is worth living? By any chance, any thought of harming yourself? Okay, and have you experienced any symptoms of anxiety, depression, low self-esteem, those things? Um, Apart from that, medical history. So because patient is concerned about body weight, but you already know that BMI 23, that could be like within normal range. So just quickly ask about some medical condition that can also contributing body weight. So ask about any diabetes related problem, any history of diabetes, any history of thyroid, or do you have any symptoms of diabetes like increased thirst, polyuria and polydipsia, and also thyroid, like any weather preference, bowel habit changes, those things. Now coming to the mental history as well. So have you ever been diagnosed with any psychiatric condition like depression, anxiety, or any body dysmorphic disorder like those type of things, or any family member also having any mental disorder or not? Lifestyle, so social history, you should ask about smoking, alcohol, very important, and also occupation, like either sedentary lifestyle or not. Okay. Have you recently experienced any changes in your health, like fatigue, appetite changes, or mood swing? So explain what is your thought in this case. So Jane, based on what you have described, it sounds like you might be experiencing some symptoms of body dysmorphic disorder. Have you heard about it? So this is a condition where individuals have an excessive preoccupied thoughts or perceived like flaws in their appearance, and which are often not noticeable to others. Okay. So it is also important to understand that your feelings are valid and many people experience similar concern. And I can assure you that your BMI is within the normal range and your health is not at risk due to overweight, which you were more concerned about. Okay. Now you also asked me about Ozempic request. So how much do you know about that medication like Ozempic? So you can say Ozempic is a medication that used basically for managing type 2 diabetes and sometimes for weight loss in individual with a very high BMI. Given your current BMI, and it may not be necessary or appropriate for you. Okay. I have few of recommendation, like definitely diet if you are really concerned about your body weight, but I say your BMI within normal range. So my advice would be follow healthy balanced diet and exercise. And if you need support, I think it might be beneficial to speak with mental health professional who specialize in that body image issues. So you can have some talk therapy. They can help you how to deal with that stress and how to improve your self-esteem as well. Okay. Um, and address emotional well-being, that is also important. So if you are worried about your partner and your partner constantly like criticize you, so my suggestion would be also couple counseling might also be beneficial for you as well. Okay. And make a follow-up appointment. So that's it. That's a case for weight reduction and Ozempic request. How important is AMC clinical handbook for the exam? There are like lots of cases. Sometimes cases are coming from the handbook. I think that will give you idea like how you should perform in your main exam and what is the key point, critical error. But nowadays, like focusing more on key point, not the critical error. So my suggestion would be if you are a beginner, just try to go through it. And after that, like there are, I would say more than 50 cases were really, really important for clinical exam because more than like 50 or 60 cases that comes past a couple of years. Okay. That can be a case of abuse. You can ask about relationship with partner. Um, yes, body dysmorphic disorder. There are like few specific question you should ask about, like because those thoughts coming her mind again and again, and it's very preoccupied. You can ask like apart from your partner, like anyone else, like has commenting that one, and you are only worried, or your other family members also worried about your body weight as well. So in this case, patient worried about body weight. So my suggestion would be think about some medical condition and then think about psychological, because based on the stem, you are not sure it is psychiatric case or not. So first, make sure you are also ruling out some medical condition as well, like diabetes, thyroid issue, any endocrine problem. Okay, and when you dig more and you came to know that it's a psychiatric case. So try to rule out anxiety, depression, adjustment disorder, and as I mentioned, body dysmorphic disorder, any eating disorder as well. Okay, so let's move to the next case. Dr. Mean, you want to perform?
Yes, doctor.
Hi.
Hi.
Okay, this is your case and your 2 minute starts now.
Okay, thank you, doctor.
You can start.
Yes, doctor. Hi, I am Dr. Min, one of the doctors here. How can I address you?
Hi, Dr. Mary.
Okay, nice to meet you. So are you comfortable right now?
Yes, doctor.
Okay, do you have chest pain at this moment?
Not now.
Not now, okay. What concern brings you here today?
Doctor, I couldn't sleep properly, and yes, like I'm having some chest pain, and also I'm feeling palpitation on and off, and that's really bothering me.
I'm really sorry to hear about that one, and I really appreciate for coming today. So can you tell me more about it?
What you want to know?
Okay, how long have you been suffering from that one?
Uh, Not really good. I'm having sleeping issues, doctor.
Okay. Does this occur suddenly or gradually?
Gradually.
Okay. How frequent does it happen in a week for your sleep problem?
Was that?
How frequent does it happen in a week?
Which one?
That sleep problem?
Most of the time.
Most of the time. Okay. So do you think it is you have to wake up at very early morning?
Yes, doctor, just frequently happening.
Okay. Any nightmare or vivid dreams?
Sometimes, doctor.
Okay. Do you notice any flashback?
Sometimes.
Okay. Along with that chest pain and palpitation, and do you notice any reason of the heartbeat?
I feel like some funny feeling of my heart, on and off.
Okay. Do you notice any swelling of your leg?
No, like last night was really bad because last night I felt chest pain and palpitation, and that's why like I wake up in the middle of the night.
Okay, I'm really sorry to hear about that one. I want you to know that today our conversation is private and confidential. You can open up to me friendly, okay?
Okay.
Okay. I saw, according to your notes, what I have noted is that you have involved in the motor vehicle accident 3 months ago. I'm really sorry about it. I'm not trying to recall it about it that one. Can you tell me more about that one?
Yes, doctor, like I had a very bad accident 3 months ago.
Yes.
I don't want to recall, doctor, actually.
Yes, I'm really sorry about it. I'm not trying to recall about it, but right now your symptom might be related to that event. For this matter, I'm here to help you. Yes. Okay. So, do you have a flashback of this memory, that bad memory, in the nighttime?
Sometimes, doctor.
Okay. At that time, are you drive alone or with the other family member or with the other person?
Driving.
Yeah, in that motor vehicle accident.
I haven't started driving yet.
Okay, I'm really sorry to hear about that ones. So, do you have to avoidance of that similar flashback or that similar problem, especially watching movie or reading books for that accident events?
Yes, doctor.
Okay. Do you feel like are you going to die or something terrible might happen?
Yeah.
Okay. Are you generally anxious person?
Um, yes, doctor. Sometimes I'm really feeling anxious.
Okay. So how about your mood during these days?
Not good.
Good. Do you have feel depressed or feeling elevated mood?
Uh, just low.
Okay. Do you have any idea of harming yourself or harming to the other?
No.
Okay. Do you hear or see the thing that the other people don't?
No, doctor.
Okay. With whom do you live with?
I'm living alone.
Okay. Any stressful condition at your home or at your work?
No.
Okay. Do you smoke?
Um, yes, doctor, I
How
do.
long, how long have you been smoking?
Just last few months.
Okay. How many cigarettes per day?
Not many, 3 or 4.
Okay. Do you drink alcohol?
Yes, doctor, I do.
How much do you drink it and how long have you been drinking?
Maybe 2 glasses per day.
How long have you been drinking?
Um, uh, maybe last few months.
Last few months. Okay. By any chance, do you use any recreational drug or illicit drug?
No.
Okay. Do you have underlying mental illness before?
No.
Okay. Do you have underlying significant medical problem before?
No, doctor.
Okay. Thank you for answering my questions. Yes, according to our assessment and our story, you have a problem with the sleeping problem, and you have a chest pain and palpitation. For this matter, we have done the thyroid function test and we have done the physical examination. No significant finding was noted, but I'm sorry to recall your stressful condition. You have involved in the motor vehicle accident in 3 months ago, which made you stressful and which you have been troubled with the bad memories and vivid dreams, and you avoid to drive your the car. So for this matter, we can be consider that we call it you suffering from a condition called the post-traumatic stress disorder, PTSD. Are you with me so far?
Yes, doctor.
Yes. All these symptoms respond to the stressful events, which can lead to the anxiety reaction. These symptoms occur as soon as after the events or the semi-take the delay reaction. In your case, whenever you recall that stressful events, there is a hormone changes and nerve activators, so which all lead to the shortness of breath and chest pain, palpitation, and you have the sleeping issue and sleeping problem. For this matter, at the same time, after our discussion, I will give the
Your time, sir.
referral to the psychologist for the exposure response therapy. Thank you for consulting today.
Dr. Min, very nice performance, very nice approach. History-wise, most of the important question you asked, very good. You gave me confidentiality statement. That is one of the key point in this case. Now, I'm going to tell you some missing point, okay?
Yes.
So, have you noticed your third task was causes of insomnia? I understand, like the main diagnosis, it would be post-traumatic stress disorder, but you should also rule out like other condition. For example, like any sedative medication patient is taking or any stimulant like tea, coffee intake. And because patient unable to sleep night properly, so how about daytime sleep? And that can also like makes her like really difficult to fall asleep at night as well. So those questions you should ask. Those are missing. And you explained nicely about PTSD, but they also ask about pathophysiology, and because of the time, you couldn't tell me about causes of insomnia. Okay.
Okay, doctor.
So let's discuss the case. This topic is a very commonly discussed case. So you are at a GP clinic, 25 years old female involved in a MVA 3 months ago. She has history of chest pain and palpitation and also coming with intermittent insomnia. Previously, she has a GP consult and no physical causes found for her chest pain and palpitation, vital stable, thyroid function, all are normal. So your task is to take a history, explain diagnosis with pathophysiology, causes of insomnia. Now, because of your time limitation, they already told you in the stem that patient medically, like chest pain, palpitation, there was no reason, and thyroid function, all are fine. So that means that you should put more focus on psychosocial history. Okay. So here, for this case, when you are going to ask about all the details about sleeping issues, please keep confidentiality statement. So just mention, Mary, whatever we are going to discuss, it will be remain confidential between you and me unless it poses harm to you or others. Okay. So ask about a specific question. So what bothers you too much? Either like insomnia, chest pain, or palpitation. So last night was the rough night. Patient had a chest pain, palpitation, and unable to sleep. And that insomnia basically started after that MVA within the last 3 months. So what is the nature of insomnia? Difficulty falling asleep, frequently awakening, early morning, also evening, and also unrefreshing sleep. Any aggravating factor like anxiety, worrying about recurrent chest pain, associated symptoms, palpitation. Ask about details, depression history, any other chronic condition, particularly any heart disease. Any medication related issue, like if your patient taking short acting sleeping pill, that can also like keep her on risk, like dependency. She might develop dependency. So ask about, have you taken any sleeping tablet or any stimulant like tea, coffee at late night? Psychological impact. So key question you should ask about any flashback, any nightmare, how about like, have you started driving after that motor vehicle accident, or you try to avoid driving, or you try to avoid that place or movie related that MBA. Okay. Key question, detailed psychosocial. So ask about mood, appetite, and any low esteem, harm to yourself or harm to others. Daytime symptom, like do you feel fatigue, irritability, difficulty concentrating during the daytime? Do you have daytime nap? Social history, lifestyle history, how about your work, any stress, caffeine, alcohol intake, physical activity, all really important you should ask. Past medical history that I need to know. So basically, based on your symptoms, I'm thinking you're having a condition, most likely we call it post-traumatic stress disorder with associated insomnia. Okay, so you had a recently traumatic event, motor vehicle accident, and that can manifest with symptoms like anxiety, palpitation, insomnia. Other diagnoses that could consider anxiety disorder or somatic symptom disorder that can also relate with that accident. Okay, I can tell you your bodily symptoms is valid, but you are also having like insomnia because of that anxiety issues. So pathophysiology for that insomnia, insomnia is a frequent symptom in patient with PTSD or anxiety disorder. Okay, and there could be like several factors behind it, people with PTSD, the symptomatic like sympathetic nervous system remains hyperactive. Okay, even after the initial traumatic event, and that leading to persistent state of like fight or like fear of that death things. Okay, and that result increase our body's hormone, we call it cortisol level, that also name as a stress hormone, and also increase like norepinephrine, that also one hormone in our body that makes us like alert, making it difficult to relax and fall asleep. So those are pathophysiology behind it. And another thing, it could be like that intrusive thoughts and anxiety. Okay, recurrent just thought, nightmare, flashback, and that's also very hard to fall asleep with that nightmare and flashback. And definitely anxiety could be another reason. So you don't need to explain all details, just in a simple term, you can explain about pathophysiology. Okay. Now coming to the management, so if management comes, then you can mention about all the CBT. So non-pharmacological intervention like CBT, relaxation techniques, sleep hygiene, and focus on like trauma-based, like trauma-focused therapy, medication sometimes also helpful, and pharmacological treatment, like you can use melatonin that also helps to restore regular sleep pattern. And causes of insomnia, as I mentioned, there could be multifactorial. That could be definitely post-traumatic stress disorder with insomnia. That could be anxiety related, or also it could be any medication related or tea, coffee intake. Okay.
Thank you, doctor.
You don't need to perform physical examination for every station unless they are asked to do. Okay. Same for physical examination finding from examiner. For example, in this case, they haven't asked you to perform physical examination or to ask findings from the examiner. So what you need to do, just taking a history, then start explaining about the diagnosis, pathophysiology, and explain about the causes of insomnia. Please explain diagnosis, reason behind it, and causes of insomnia first, and then if time permits, then explain about CBT, some management, okay? Okay, let's move to the next case. Dr. Vishnu, are you there? Yes, very good point that excessive alcohol also can cause insomnia. Hello, Dr. Vishnu, can you hear me?
Yes, I can again hear you. Yes. Thank you.
Dr. Vishnu, I'll change the case. I'll give you to another case, okay? This is your case.
Okay, thank you.
And your 2 minutes starts now.
Yeah.
You can start.
Good morning, Henry. I'm Dr. Vishnu, your doctor today in our GB clinic. From the notes, I came to know that you are unwell after going for holidays overseas. Can you tell me more about what is unwell? How do you feel right now? Can you tell me more about that?
Yes, doctor. I feel some flu symptoms. I feel hot and cold, doctor. I'm not feeling well. Very tired.
Okay. So that means when did you go overseas? When did you came back? Where did you go?
It was 2 weeks ago. I
Oh.
came.
Okay, so you came back 2 weeks ago and you're not feeling well for the past 2 weeks, or how many days? Since how many days you are not feeling well?
Last couple of days, I'm not feeling well, doctor.
Okay, so you for a couple of days you're not feeling well. So what is flu-like symptoms means? Can you tell me more about what exactly is happening with you?
As I mentioned, doctor, I feel hot and cold. I feel like some cough and just a like body ache, not feeling great.
So, okay, you have body aches and cough and cold. Okay. So, any vomitings you have? Any vomitings or anything you have?
No,
No. Like, do you feel fever? Did you measure the fever? Or are you feeling, do you have any fever?
I feel so, doctor.
So, did you measure with the thermometer in your home?
No.
No. Okay. So only for the past 2 days only you have been problem with the body pains and the cough, but other than that you are okay. 2 days before you are absolutely normal.
Last few days I'm feeling sick, doctor.
Okay, okay, that's good. And I would like to ask you, like, when you went overseas, so did you smoke there? Did you take alcohol? Can you tell me something what you did there?
Yes, doctor, that was a fun trip with my friends, and like we took alcohol, smoking, and yeah,
Did you use recreational drugs?
yes, doctor.
Yeah,
Like
did you share it in like drugs? How did you take? Is it a tablet or injections? How did you take it?
injection, doctor.
So did you share the needles with your friends?
Yes, doctor.
Okay. Whatever this is, I assure you that whatever we talk here, it is absolutely confidential unless it is harmful for you or to others. I won't. It will be confidential. Is it okay? I need to ask you some few personal questions.
Yeah.
Were you active sexually abroad or now when you went overseas?
Yes, doctor.
Did you protect yourself? Like, is it a safe sex you are in, or did you protect yourself?
Yes, but I couldn't remember all the time.
Oh,
Yeah.
okay. 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 Thank you for that. And uh, I would like to check some more like any ongoing issues with your any medicine, any like conditions would I need to know regarding like diabetes or hypertension, anything you have, any drugs you are taking?
No.
No. Okay. Henry, I need to check, examine you a little bit before I go for supporting you in this case. So I will check your. I would like to check your general condition, appearance, and everything. Is it okay?
Okay, doctor.
I will be back in few minutes. I will talk to my examiner and back to you in few minutes. Okay, Henry?
Okay.
Examiner, I would like to check the general condition of my patient regarding his general appearance, any like any pallor, any rash or any icterus is there, and I would like to know any cyanosis or clubbing is there. I would like to know, examiner. And then I would like to see the capillary refill time also I would like to see, and BP, and I would like to measure the blood pressure, pulse rate, and heart rate also I would like to check, and then especially on any like oxygen saturation also I would like to note with my patients. And in focused examinations like respiratory system, I would like to check for any crepitations or air entry is safe in both sides or not. In CVS exam, cardiovascular examination, I would like to check for heart sound present, S1 and S2 present or not, and apex beat location also I would like to check. And then in all areas, any murmurs present or any visible pulsations present also I would like to check in the cardiovascular examination. And in abdominal examination, I would like to check any masses felt in the abdomen are soft and bowel sounds heard or not. I would like to check. in this case, and then I would finally I would like to do some office tests like blood sugar and in urine dipsticks also I would like to check, and so I would like to know what the physical examination findings examiner.
So patient is ill looking, patient vital sign, respiratory rate 18, saturation 96% on room air, blood
Mhm.
pressure 137/95, heart rate 95, temperature 38.9, nil sign of pallor jaundice, no lymph node enlargement. Respiratory examination, you can appreciate there is a bivasal crackles on the lower zone. Cardiovascular examination, heart sound dual audible. There is a pansystolic murmur, and that murmur radiates to axilla. Abdomen examination, hepato and splenomegaly 2 centimeter below left costal margin. That is non-tender. Urine dipstick test negative, blood sugar 5.4, and peripheral there is a pedal edema positive.
Examiner, I'm discussing with the patient or with the examiner. I would like
With
to
the
know.
patient.
Okay. Henry, after taking your history and examination and talking to my examiner, I'm thinking because you have been gone to overseas, and you were there is a problem in your heart, like because of the shared needles, the infection went up to the heart and producing some valvular problems and also murmurs in this case. So mitral regurgitation, also heart failure, signs of heart failure also present. So before confirming, so mostly heart failure with mitral regurgitation, valvular. I'm thinking in your case, Henry. And but however, I need
Your
to.
time's up, doctor.
Oh, thank you. Sorry for that.
No, that's okay. Very nice performance, Dr. Vishnu. History, that was good structured. Few important question was missing. For example, when you asked me about temperature question, I told you like I haven't measured at home. So you should ask about like details, whatever positive findings you got, you should dig more. So ask
Ah.
about any shivering, any chills, trigoning, either is the constant or not, and did you take any paracetamol and does it help or not? So details fever. You didn't ask me about chest pain history. You didn't ask me palpitation. Those question was missing, and then
Yes.
bowel bladder question was also missing. You put more focus on definitely like there was a history of heroin and also IV drug use. You asked me about sexual history. That was really nice, but like infection history, bowel bladder history, those are missing. And physical examination findings. Okay, now that needs to be discussed very properly because you guys are going to give face-to-face exam. So
Yes.
for physical examination finding from the examiner, you need to ask one by one, and then you will get the findings.
Okay.
How you asked me, that was not the correct approach. Okay.
Okay. Thank you.
So you should ask examiner, may I know the general appearance of my patient? Is there any sign of pallor, any jaundice? Then wait for your examiner response. Okay. Then ask again, like any sign of like lymph node enlargement, any other findings. Then ask about vitals. So ask two questions like how about respiratory rate, saturation? What about the temperature, heart rate, blood pressure? Okay. Examiner, may I know respiratory findings like inspection, then auscultation findings, and wait for examiner response and then move to the next system exam. Okay.
Yeah. Thank you.
Sometimes in face-to-face exam, you might get PFE card. So examiner will provide you PFE card. So in that case, my suggestion would be read it loudly. Okay. For example, you might get PFE card like that. I'll show you. Like this card, you will get it. So just read it loudly so that examiner also understand like what actually important thing you were looking for. Okay. And then like your task was differential diagnosis. You mentioned like that heroin and that could be related with the heart infection. Later on, you mentioned about heart failure and valvular problem. That could be, yes, one of the possibilities, but patient presented with you fever, chest pain, palpitation, with high grade of temperature and all the cardiovascular findings and given history of IV drug use, we should rule out infective endocarditis first.
Yes.
Okay.
Yes.
So it's
Yeah.
a case of infective endocarditis with heart failure. Other differential could be hepatitis or other, it could be HIV or other like travel related infection. Okay.
Yeah. Thank you very much.
No worries. So let's discuss the case. So you are a GP, 32 years old. Henry came with complaint of feeling unwell. He returned from holiday overseas where he took heroin. So your task is his GBV differential diagnosis. So introduce yourself nicely, and then because you are going to ask very, very sensitive question, because patient will give you travel history, heroin exposure. So just make sure you are giving confidentiality statement, okay? Now, if you are concerned, like this is the acute case, please make sure you are asking vital sign. But if it is a chronic case, you can proceed without asking vital sign. It depends actually, like how severe the case is, either say acute or not. So ask about what do you mean by feeling unwell? What happened? So patient went to a trip and had a party with a friend and took heroin. Any other drugs? And how did you take it? Was it IV drugs and needle sharing history positive? And since then, when you feel tired, what was the symptom basically? So patient feeling tired and along with all the fever, chest pain, palpitation, okay? Ask about, do you think that tiredness getting worse? Any aggravating relieving factor? Other activities during the trip, like did you enjoy any street food, unbottled water? Have you done tattooing, body piercing? What about sexual activity? Practice safe sex or not? Regarding tiredness, how long you feel tired? Do you tired all day or like any particular time of a day? Do you notice any skin color changes, any color changes in your pee and poo, any lumps, bumps in your body, any flu-like illness to rule out HIV, okay? So ask about any pain anywhere, any fever. So if anything positive, you should ask more, okay? So here fever positive, ask details. Then chest pain, again ask details, palpitation, then any short of breath, cough, any pedal edema, and then any tummy pain, nausea, vomiting, any bowel movement changes, any bladder habit changes, okay, any past medical history, surgical history, smoking, alcohol. So as I mentioned, physical examination findings, ask one by one to your examiner. So examiner, I would like to know about general appearance of my patient, then vital sign, then ask about details, hand examination, respiratory, cardiovascular examination, abdomen, and then office test, okay? So most likely you have a condition, we call it infective endocarditis, and that could be related with that secondary to heart failure. Why I'm thinking that? Because it happens when infection causing bug enter the blood and cause infection of the inner lining of the heart. And in your case, you had a history of shared needle, so that could be the source of infection. And that infection going to your heart and affecting your heart valve, okay, and that's why like it's failing to pump out blood, and I have noticed some abnormal heart sound, okay, and I also noticed you are having short of breath, cough, and also having pedal edema. That's why I'm suspecting you could have like heart failure as well. Other possibilities could be hepatitis B, C, and HIV that could be also related with that needle sharing infection. Other travel related infection could be malaria, dengue, typhoid, or STI infection. Okay. Other possibilities could be cholecystitis or liver problem, but those are less likely because you don't have any jaundice history. Okay. So that's a case of infective endocarditis with heart failure. Yeah, definitely. For any examiner, or sometimes this they mention you need to take a history from nurse. So that time you can also use medical jargon. Okay. As I mentioned, Dr. Sage, about hemodynamic stability. So any acute case, you should ask about hemodynamic stability. If you are not sure, there is no harm to ask like examiner before starting. I would like to know whether my patient vital is stable or not. You can ask. Okay. For example, like this patient could present with septic criteria like low blood pressure, tachycardia, temperature, like any of the two vital sign criteria can meet, and we can call like patient like falling under septic criteria. So let's move to the next case. Dr. Dhruti, are you there? Hello. Hello, Dr. Dhruti, are you there? You want to perform? Dr. Tant, are you there? Dr. Umme Nahida Akhtar? Dr. Vindhya, are you there? Okay, then Dr. Shoaib, you want to perform?
Hello, doctor. Yes.
Hi. This is your case and your 2 minute starts now. Can you start, please?
Yes. Hello, good morning, David. My name is Dr. Shoaib, one of the medical officers here. I'm so sorry to know that you had a fall today morning. How are you doing now?
Doctor, I'm having pain in my left leg and hip.
Okay, can you tell me how severe is the pain on a scale of 1 to 10, 10 being very severe?
It's 5.
Okay. Do you want me to give any painkiller right now?
Yes, please.
Okay, do you have any allergies to any medications?
No.
Okay, I will ask my nurse to arrange a painkiller for you. Uh, Meanwhile, I would like to ask you a few questions if that's okay.
Yeah.
Okay. Okay, David, I can see that you had this left knee replacement surgery uh 3 days before. So how are you doing in the past 3 days?
Um, it's okay, doctor, getting um better day by day, but today I had a fall and after that, like I started feeling pain.
Okay. So what were you doing at the time when you had a fall? You were in the washroom, were you passing urine or having a
Yes,
bowel movement?
doctor. Actually, I was yeah, going to the toilet and like suddenly I felt like weakness on my left leg and unable to
Mhm.
support my weight and like ended up with having fall.
Okay. But was anyone there with you that time or you were alone?
I was alone.
Mm-hmm. Uh, you went to washroom before in these 3 days alone?
I need help, doctor.
You need help, okay. So before you fell down, did you feel any dizziness, any chest pain?
No,
Okay. Do you feel any chest pain or shortness of breath now?
no,
Okay. Only do you have any pain in on your left knee?
now, yes.
Okay. And how about your right knee? Is it okay?
Yeah,
Okay. When you fell down, did you hit your head anywhere?
no,
Did you have any loss of consciousness?
no.
Okay. And did you have any injury anywhere else in your body?
I don't think so.
Okay, that's good. Uh, okay, David. Do you have any other past medical history like hypertension, diabetes,
Yes, doctor. I'm on blood
Mhm.
pressure pill.
blood pressure pills? Okay. I would like to check your hemodynamic stability. Let me check your blood pressure. Let me review the blood pressure, how what the nurses noted down. Dear examiner, can I know the patient's blood pressure?
140 by 80.
The pulse rate, temperature?
Normal.
Okay. Uh, okay, David, your blood pressure looks fine. Did you take any medications before going today?
Yes, doctor, all my regular medication for blood pressure, diabetes, and
Okay.
yeah,
Okay. Okay. So you're taking medication for the diabetes also.
yes,
Are you taking any insulin or just tablets?
that is the tablet.
Tablet only. Okay. Okay. Uh, okay, David. I would like to check your blood sugar levels also, if it is available. Dear examiner, what is the blood sugar level of the patient?
7.3.
Any ECG available?
You can order.
Okay, ECG, any findings in the ECG?
Pending.
Okay. Okay, David. From the history and from the history which I took from you, uh, you had a left knee replacement surgery just 3 days ago, and you're hypertensive and diabetic. There could be many reasons for the fall. Sometimes due to some syncope, like vasovagal syncope, which means after passing urine or using a toilet, you might have sudden drop in your blood pressure, which could be the reason. But your blood pressure looks okay now. Sometimes due to drop in your sugar levels also you can feel some dizziness and you can fall down. That could be another reason. Sometimes if you're having any cardiac arrhythmias, especially after surgery, you can still have these symptoms. But from the your blood pressure sugar readings, it looks very unlikely. Most probable reason is because of your knee replacement surgery, you still need assistance with mobilization. Okay, I will involve physiotherapists in your care so that they can they might teach you some basic exercises and help you with the mobilization. You still need assistance. You cannot go to the washroom alone because there is a risk of fall, especially in your age. If you have a fall now, it would be very dangerous for you. Are you with me so far?
Yes, doctor.
Okay, so you will involve the physiotherapist. They will explain you how to mobilize by minimizing the risk of your fall. You need to follow that, especially when you're going to the washroom. If there is any slippery floor, that could be another reason also. So we need to be careful with that. Okay. For now,
And
for now, the nurse already gave you a painkiller. The pain should be okay the pain should get better. And also, I would like to get an X-ray done for you, for your left knee, to see if everything is okay. And also, I will involve my surgeon, the orthopedician, who will come and examine you if there is any other acute changes in your knee, if you have any swelling or any bleeding in the knee. How is the operation site? Is that okay for you?
okay.
Okay, do you have any other questions, David?
Anything else that I need to know, doctor?
Yeah, like I said, you still need help with your assistance, with your daily life activities, which I would, because you're not alone in this journey, I will be there with you, and also the physiotherapy team will be there for your rehabilitation. They will teach you to assist you in doing your daily life activities like going to the washroom or how you're able to walk with the help of an walker. Okay, and also you need to be careful with your mobilization. Like whenever you go to the washroom, you need to make sure that the washroom is not slippery, you're wearing proper footwear, and you always have some help at hand. So you cannot be alone, especially in the initial period of your journey. Okay.
Okay. Anything else that I need to know, doctor?
Nothing else. That's it. I will see you after once the orthopedician and the physiotherapist will come and assess you.
Um, you want to stop?
Yes, I can have no blank click.
That's okay. Nice performance, doctor. You still have time, around like 30 seconds.
Okay.
Most of the things you addressed. Now, just I'm telling you a few things. In here,
Mhm.
I feel like just in between when you took history,
Mhm.
then kind of like lost of like bit of haphazard, like you asked blood pressure and coming back, and
Yeah,
then
actually, I forgot the hemodynamic stability in the start. I should have asked regarding that.
That's okay.
Yeah.
And another thing is that you didn't ask me about opioid used because patient is a day three,
Mm.
so another like opioid use could be another reason for fall. And high blood pressure, I give you patient is taking blood pressure pill and you found blood pressure 140. That was nice, but you forget to check about postural drop. Okay.
Oh, okay. Yeah.
So because our second task was explain the reason of fall, so that could be multifactorial. It could be due to post-op like muscle weakness, it could be related to pain or opioid use, or it could be due to orthostatic hypotension and other reason as well. So that's why like we need to ask all those things. Regarding the pain, so you didn't ask me about what other pain medication I'm using because it's a day three post-op patient should have
Yes.
some pain medication on the background. And opioid medication sometimes can cause like that sedative effect. That could be the reason for fall. Otherwise, yeah, management-wise, very good. You order X-ray to rule out fracture. That was one of the important thing, and also analgesia and then allied health input. So let's discuss the case. 70 years old, Mel David, post-operative day three following a left knee replacement surgery. And the surgery was uneventful and he had begun to mobilize with assistance. And the patient fell in the bathroom this morning and no major injury was happened, but the patient complains of pain in the left leg and hip. So your task was to take a history, explain the reason of the fall and the management. Um, so here, again, you can ask about vital sign at the beginning and then ask about event of the fall. So the fall occurred while walking to the bathroom and the patient reports feeling sudden weakness in the left leg and inability to support his weight and that leading to the fall. After that fall, patient also feels left leg pain and also hip pain, mild to moderate, and but he's able to move the limb. Okay, he denies any dizziness, no vision issue. Medication wise, you should ask about details like postoperative analgesia, including opioids, and also any blood thinner because patient had a fall, so that can also lead to like bruise, like those things. Any past medical history. So patient having history of high blood pressure, diabetes, osteoarthritis, and that's why like patient having that knee replacement surgery. Any history of previous fall, any long-term medication use. Okay. Then social history, you can quickly ask about any alcohol smoking because alcohol withdrawal can happen, but it's a day three post-op that is very rare, but still you should ask. And any mobility, so previously independent, but now using walking aid. And after the surgery, like did you like walk? Just ask about it. So coming to the fall reason, so that could be a combination, that could be intrinsic factor like A is medical condition and extrinsic factor could be recent surgery and medication related. Muscle weakness can happen post-operatively and pain because patient already having left knee pain, post-operative pain, and that leads to uneven weight distribution and instability, and that could put the patient high risk for fall as well. Okay, post-operative medication like opioid use, another reason, anticoagulation. And other issue could be orthostatic hypotension. That is very common in hospital settings for fall. So whenever patient gives you history about high blood pressure, patient is taking pill, please make sure you are checking standing and sitting blood pressure. Okay. And then, so differential diagnosis for the fall, it could be like postoperative muscle weakness or imbalance. It could be medication related, like opioid induced. It could be hypertensive medication related or orthostatic hypotension or postural drop. Dehydration, electrolyte imbalance. It could be diabetes related, like patient also gives you history regarding diabetic and he's taking oral hypoglycemic agent, okay? It could be cardiac related, so that's why like you need to order ECG to make sure there is no arrhythmia, okay? What could be the management? So management, immediate management could be pain relief. Basically, we need to do all thorough physical examination, neuro-obs, musculoskeletal examination, vital sign, and then investigation. So investigation, you should rule out any fracture. So order X-ray and order blood test as well, like blood sugar, electrolyte check, and ECG. And then management. So pain control, then physiotherapy, mobility aids. If you notice patient is dehydrated, give him some fluid, nutritional support, and also explain about prevention of future fall. Like, so that would be multidisciplinary team involvement. And if you need to review medication, especially antihypertensive. If you notice patient having significant postural drop, you should also review antihypertensive, antihypoglycemic medication as well, okay? And if there is a orthostatic hypotension, you need to manage that one and educate your patient regarding that. So that's the case for postoperative fall, reason, and the management. So the question, yeah, good thought, Dr. Nisanti. That could be pulmonary embolism related. So ask about either patient having any short of breath or any tachycardia, any like lower limb pain to rule out DVT. And diagnosis could be postural hypotension. Yeah, that could be possible reason for fall. And if Dr. Schwab, if you missed initial hemodynamic stability, you can ask after finishing history, you can say like, I'm going to ask my examiner about vital sign, and then we'll get back to you. That's all for today. Do you have any question for today's class or anything you need to ask about that 5 cases today I have discussed? If you don't have any question, then I will hand over to Dr. Arshan then.
All right, guys. Thank you, Dr. Cynthia. So So that's the end of tonight's session. I hope you enjoyed the session. It is always tricky, as I say always, that the role play sessions are initially a bit overwhelming, but you could see that today a lot of other who has done the role play, they are also quite confident, most of them. So it's important to understand that like you would not get that much confidence within a day or so. The confidence comes with lots of practice. So keep on doing the cages, and at some time you'll also notice the difference. Okay. So your next class will be on Wednesday, where we will finish the cardiology theory and we go from there. Yeah, so classes are 2 hours duration all the time. Okay. I will leave you to that. Thank you, everyone. Take care. Have a good night. Bye.